So we're going to start with Gloria. I think we're going to go with yeah, they don't have the slides, so he's sending. So Hassan is sending the slides, and Hassan, can I move on to Gloria, and then we'll welcome you back. You back to the podium, and once the slides are done. So let me move to Gloria. Gloria is going to do an overview of the use of social and behavioral communications changes to address under-registrations of birth. And she is the CRVS specialist from West and Central Africa Region Office of UNICEF. Gloria, welcome to the podium.
Thank you. Good afternoon. I hope we are all feeling refreshed after lunch. So, will you be moving the slide? Okay, thanks. I'll be speaking to you about what we call SBC, Social and Behavioral Change Communication, to address under-registration of births. And this is mainly drawing on UNICEF's on-the-ground experience and the information we've been able to gather in this area. So why do we talk about SBC at this point? We are all aware we have a problem to do with under-registration of births. We are talking about 150 million children across the world. In Africa, we are talking about 90 million children aged below 5 years. And we also host 3 countries that contribute to the highest levels of unregistered children globally. That is Nigeria, Ethiopia, and DRC. And so addressing issues of under-registration is critical. And for us also, it's not just about countries that are underperforming, but also countries that are looking at the last mile of children. We often see that when the registration levels get high, it gets even more difficult to close the gap. So it's about reaching the very last population group. Now, when we talk about CRVS reforms, often we do talk about the supply side factors. We talk about legal and policy reform, strengthening systems, capacity building, but we often may overlook the behavioral and social and contextual aspects of this work, and the need to invest in this if at all we are to move towards universal completeness. So closing the registration gap really requires that we also understand and shift the beliefs, the norms, and the practices that shape how societies register children and how they perceive and engage with the civil registration service generally. And we know that behavior is not just shaped by our own levels of knowledge and perception. Behavior is shaped by the societies in which we live in, the communities in which we live in, and how they influence us based on their perceptions and practices as well. So it's looking across multiple layers and influencing change at an individual level. So again, SBC is is an integrated approach to understanding and influencing the social and cultural behaviors and norms that affect how people make choices and what they practice. And it's mainly combines evidence-based communication, community engagement, and participatory action. Most of us are familiar with communication for development, which is a terminology that has been used over the years. And SBC is a more comprehensive approach to that builds on communication, but goes beyond that to looking at changing norms and participatory action. Now, when we talk about social and behavioral norms, I just wanted to give you an example of Guinea. And Guinea has been referenced in this meeting for quite a few times in both negative and social and positive ways. Here, I just wanted to mention some of the social cultural norms that are in Guinea, which is a country in West Africa. So here, civil registration is really viewed by members of the public as a state action. Basically, the population does not feel that it is they should engage in any way. They feel that it belongs to the government. It's something that the government should should bother with. And we see in this country that really religious ceremonies, religious activities take precedence over civil activities, and especially when it comes to birth, death, and marriages. And in terms of birth registration, we see that the practice of baby naming is really sensitive. Communities have to complete the 7-day period, and during that time, the mother cannot leave the premises, and this is what takes precedence. This is what takes priority at community level. We see that it's men who are engaged in terms of documentation, and they're the ones that make registration decisions. And this is mainly linked to low female literacy rates and the lack of know-how. Then finally, when it comes to death registration, when it comes to that mourning period, really the practice in the community is that you don't go and register, you stay with the family and mourn the baby and mourn the deceased. So these are some of the practices that are real in these communities. Now, more generally, UNICEF looks at this and looks at it across 3 critical areas: the social and behavioral drivers of non-registration, from the psychological angle, the social angle, and environmental barriers. And this I know most of you are aware with. We talk about awareness issues, people feeling it's irrelevant, people distrusting the government, gender dynamics, which came out very strongly during the marriage and divorce sessions. And we have all of these cultural practices. So let me not go into that in detail. So how we looked at it at UNICEF, we look at 4 complementary SBC approaches in terms of CRVS strengthening. The first one being human-centered design, where we prioritize designing with communities and not for communities. And here it's mainly about ensuring that the services that are being designed are fit for families and the real lives that their real life experiences. And then we also talk about behavioral science-informed strategies, which is mainly around understanding why people will act or not act, and in this case, when it comes to registration. Then we look at community engagement and trust building. This is where we work very closely with religious leaders, traditional leaders, and community leaders, building dialogue through different formats that are applicable to societies, and making sure that we are building confidence and social ownership of registration. And then lastly, it's how we leverage digital technology to reach populations, but also to encourage feedback from members of the public as to how they feel about the registration service and how it's structured, and generally encouraging that communication and dialogue. So these approaches should work in synergy, and they have proven in many occasions to strengthen registration numbers and also to increase trust between communities and governments. So based on the work that we've done, I would cite 4 key things that we believe work. And the first one, as I mentioned, is to do with how we engage with religious and traditional leaders, and especially here in the African context, what we really recognize is how a separation between the laws that were adopted, or how the practices that we adopted from the post-colonial regime, to how our African societies function in terms of traditional leadership and the role of the local community leaders. So engaging these leaders becomes very critical in creating trust and participation. And then we also see in many places where populations are really in remote areas, we've seen encouraging results from use of mobile registration units, and especially when they are coupled with a digital innovation along with them. And then community and awareness campaigns. And lastly, when we talk about interoperability and decentralized service delivery, this especially is around recognizing that services need to be closest to where members of the public go, because that is their behavior. So if mothers are going to health facilities to deliver, or they are going to seek immunization, you need to design services along that pathway rather than designing services that are separated from where they will be going on a natural day. I'll conclude with this case study from Chad. Chad is one of the really exemplary countries that we are really proud to showcase, because One, it's one of the countries with the lowest registration rates. They're at about 22% in terms of birth registration. But over the past few years, they've been able to come up with a technology that has been heavily informed by SBC's research, and that really responds to their society, their context, and their culture and traditions and pathways of life. They have this digital platform known as TaskJill, and it is designed in a way that reaches the diverse context of Chad in terms of mobile populations, refugee populations, nomadic populations, and basically remote communities. The platform operates online and offline. They've placed it in multiple service areas, from, hospitals, vaccination centers, primary schools, in every potential place where the pathway of mothers is, TaskJill is there. And what they've been able to do is to make sure that it provides the service of our one-stop time. So the mother has just to be in contact with TaskJill one time and the registration is completed. So it's basically a combination of digital innovation, and of course they engage a lot of the community leaders they've engaged a lot of community leaders, traditional leaders, in making sure that it is rolled out and that there is uptake to that. So just to close, to say, yes, we do believe very strongly in social and behavioral change at UNICEF. We invest very heavily in this area in terms of how we work with governments, and we believe that it is a critical foundation for change. Thank you.
Thank you. Thanks so much. She started by saying, I'm not very good at doing this presentation. Can you imagine? She was amazing. But I have a question for her before she goes. This participatory approach is, of course, amazing in terms of development. Well, we are used to sort of seeing, the special skills like data people, economists, and for SBC work, what kind of a skills mix do you need actually to develop for a team?
I'm not sure I can answer that.
But I mean, just try.
What type of skills do you need to build?
That's the sort of analysis that you have done, and also the delivery of those understanding. Do you need psychoanalysts? Do you need psychologists? Do you need social experts? I mean, what is the skills mix of your team in UNICEF?
Shaida, I come from a statistical background, so I'll first say that the first skill you need is to be able to do research and be able to understand what your data is giving you, and then from there be able to interpret it from an SBC angle, but I don't know what kind of skills they have. Thank you very much.
Thanks, Gloria. Appreciate it. It looks like we have solved that's yours, I think. I think we have solved the PowerPoint problem of Ehsan. So Ehsan, we'll welcome you back to the podium, and I remind everybody, he's chairperson of the Intersex Asia and Executive Director Campaign for Change, and you have 10 minutes.
Yeah, thank you so much. So sorry for some technical issues. I have already sent my presentation to someone, but they didn't get it. Namaste everyone. My name is Ishan Rigme. I am from Nepal. I am an intersex individual. Okay, I am an intersex individual. I'll share the presentation from the definition of intersex. Probably we all have lack of understanding on intersex. Could you please?
Yeah, you got it.
I have to. How do it? Okay, I think we all might have the lack of understanding like what intersex mean. Intersex is an umbrella term to describe a person born with one or more innate bodily variation in sex characteristics with the genital, reproductive organ, chromosome and hormone pattern that don't fit typical definitions of male and female, which is the social and medical standard. And nearly 2% of the population are intersex, which may discover immediately upon birth. We have the genital pattern. We cannot identify child as a boy or girl, and this intersex pattern we identify at birth, and some variation we identify later in life, some variation we don't identify. Because their body are seen as a disorder, intersex children are often subjected to multiple human rights violations. One is the major violation is unnecessary medical interventions, and including the discrimination in education, health, and sport. Because we don't have the, like all the intersex people who have the innate variation of sex characteristics that doesn't fit with the traditional standard of male and female, those people are out of the CRVS system. So that's why we have been talking from the yesterday, CRVS is not only counting the people, it's about the recognizing the every life, right? So still intersex population are out of the CRVS system. So that's why they have been facing multiple kind of violations. One of the major violations is unnecessary surgery. When child born with the innate variation of sex characteristics that doesn't fit with the traditional standard, social and medical standard of male and female, those child has been gone through the unnecessary surgery. It's crucial that we have to understand being intersex is not about the sexual orientation and gender identity, it's about the biological sex characteristics, which we defined with the genital pattern, hormone, chromosome, and reproductive organ and their development. And common misunderstanding is still intersex people are misunderstood as a third gender and transgender. Specifically in South Asia, intersex people are understood as a hijra. And those misunderstand intersex people are not open in the society, and their family also try to fix their like sex and gender identity which fit with the binary notion of sex. These unnecessary surgery and practice violate the intersex human rights, and our government, like basically in South Asia, intersex individual are included in this some umbrella term as a third gender and transgender. It might seem as an inclusive, but it is the specific identity of intersex individual. Yeah, like when we see we didn't. Oh, sorry. Can I? Sorry. Yeah, we are totally out of the CRVS system. We don't have the fact, like data of the intersex population, but as per the expert, nearly 2% population are the intersex individual. They are not like included in any CRVS system and even the national census. We are truly appreciate the government of the Kenya has taken the like step to include the intersex in the national census, and now recently they have included intersex in the birth registration. But if you see around the world, in no one country they don't have the provision to record the data of the intersex individual. And those nearly 2% of the population out of the CRVS system, like if you see my home country, Nepal, if you like take the data from this slide, almost 600,000 people are out of the CRVS system in any like CRVS system, either birth registration or marriage or death registration. Like I am an intersex individual born with female genital and grown up me as a female, but my physical development when I reached age 13, my physical didn't develop as expected for the female, right? And still my document are in female name. I look like a man, right? And I am out of those CRVS system. I'm relationship with my partner for 10 years. My marriage is not in the CRVS system. So those 2% of the people out of the any of the CRVS system, either birth, either marriage, or either death. And these challenges, counting the intersex individual in social stigma, clinical non-disclosure, definal ambiguous. Like none of the intersex individual, their variation doesn't disclose from the hospital, because many hospital has the provision to fix the intersex individual where their body doesn't fit with the binary notion. Yeah. Yeah, visibility, yeah, we have been talking from the study, CRVS is not only for the counting the people, it's about the recognizing the people and validating their identity. So those 2% of the people are out of the CRVS system. So we can imagine those people are out of the social opportunity and their dignified life in the society, and they have been facing the multiple forms of violence and discriminations. And intersex individual, there is the ambiguity of the understanding on intersex, and even their identity is based on the sex characteristics. They are not included in any document, and some countries they have included intersex in some of the ambiguity definitions. Like if you see in India, intersex people are under the transgender, but transgender and intersex is totally different, right? If you see in Pakistan, intersex are included in the trans bill, so like the trans definitions. So these kinds of ambiguity, like provision for the intersex individual, erase their true identity and data. And when the people don't included in the CRVS system, and those people has been facing the societal pressure to conformity, because many intersex individual, they are going unnecessary surgery to fit within the binary notion of the sex, and medical pathologization. Many parents, they think their child is not fit within the societal norms and structure, and they are promoting the pathologization of intersex individual. They are erasing their bodily integrity, and they are and they are facing the non-consensual intervention, which is their physical and mental health. And if you see in the Asian country, there are now some progressive step on intersex. In India 2019, intersex people are included, there is the verdict on ban on unnecessary surgery in India 2015, and in Philippines in 28, one of my friend got the court case, one of my friend got the court case to get the identity, to change their personal detail. In Nepal, we have some provision in the birth certificate, birth information form, there is the male, female, and other. Other is very
You're not in the right.
oh, this is the right.
Just move to life course.
Sorry.
Running out of time.
Okay. Yeah, sorry. In Nepal, Nepal government has included other in the birth information form, but is it not relevant? And recently, Nepal Supreme Court has ruling the self-determination without medical intervention. This is the opportunity to lobby of the intersex individual. And Thailand, there is the bill has been drafting, and for the intersex marker. And Bangladesh, there is huge important change. The passport has included X gender marker, and there are the way forward. We should have the distinct recognition of intersex individual. We should have this separate section for the birth registration of intersex individual, because it's the identity is about the sex characteristics. That's why we should have this separate legal recognition to ban the unnecessary surgery, and we should have the self-determination CRVS marker, because sometimes it is not self-determination, so it's forcefully have their identity which doesn't align with their gender identity and expression, and also with their physical development. And we should have the desegregation data. Now Kenya government has included intersex in the national census. In Nepal government has included the other, and other mean it's lesbian, gay, bisexual and transgender. There is no desegregated data. And we should have the replace the depathologization. Still, intersex people are understood and treated as a disorder of sex development. It is not disorder of sex development. And we should have the consult with intersex-led organization and intersex individual to get their proper data. And we also should respect their privacy and confidentiality. Thank you so much.
Thanks a lot. Thanks, Hassan. And sorry for rushing you. This is such an important topic, I know, and beautiful slides, but we're just short of time. So let me now move to you, Aurora. Be careful with those chairs, by the way. Aurora is going to be giving us a presentation on identifying and engaging social and economic barriers to registration of vital events in Guatemala. Sorry, yes, go ahead. Are you going to be speaking English?
Yes.
Yes.
But I can speak in Spanish. It's an option, no?
Sure.
I don't think so.
Can you do English?
Yeah.
Okay. Do you want Spanish or English? She can do both. English?
Yes, I know it's in
Okay,
English.
don't work very well.
First of all, I want to thank to be here. It's a really nice experience to share how in Guatemala do gender statistics and know how in other countries do the same. And then I identify that we have the same problem, but we resolve different. So first of all, when we want to talk about gender studies, it's important about how the society works, because some of the resistance or when people don't make a good statistic is because in Guatemala it's a very conservative and religious society, so it's difficult to change when we talk about women's rights, human rights. When we talk about this topic, we need to talk about the history of our country, the colonization. We need to talk about the war. We need to talk about dictatorship, because the conservative and religious topics come from these problems. We try to change some ideas about how it is important that the women have rights, the woman can have a formal employed, to have autonomy. And this is a very difficult topic because our society is divided. There's some people that is from rights, and some people is no, that we are conservative, and this fight is still in and actually another thing, the inequality and exclusion is nothing new. The history of Guatemala was very difficult. The new government trying to build a politics and statistic, but it's very difficult to change in the institutional, because we had to form a day in human rights, we had to form in indigenous rights, and it's very difficult because they put her religion and her conservative idea first, and this is difficult that we have information about their culture, about how works, how make their lives. Another try that we do in Guatemala, we try to work on the symbolic recognition of indigenous women and indigenous people, because when we talk about indigenous people, we have to we had about that they had the right, they had autonomy, and some people don't like this kind of topic. Another thing that I would like to share, in Guatemala, we had the National Statistics System, which gives us the obligation to have access to the record or all institution of the government. We work a lot with the RENAP, that is the National Register of People of Guatemala. The RENAP have a lot of cover, but in all municipalidades and department, but we know that there are many communities that are so far from the officers, and we try to do some action to make better the registration, but we had limit as internet, but the coverture of health and schools is very huge, but this helps us to get a better register. Another thing that we worked is we had, let me search. I didn't find, but I would like to say it that most of the biggest problem when we have to avoid it in the statistics is that the people don't trust the government, and it's difficult to go to their house. They don't open the door when we had the surgeries, or when they go to the officers, they say, why you want my DPI numbers? And we say it's important that you give us to us to know how many people we attended, but the people don't trust the government, and this trust comes for the colonization from the war, when 30 years ago the government kills indigenous people. How we expect that the people, indigenous peoples, trust in our government in our action. So I think that this is one of the difficult things that we found. And to finish, I would like to say that when we talk about gender and equality, it's important to change some ideas by ourselves. In the case of marriage and early unions, it's important to change the idea that the ultimate realization for women is a married or have children. It's important to work and say that we can marry again and have children when we're more older. First, we need to have a career. First, we can study, and then we can have children and marry. I think that change this idea is very difficult. The people say that, no, the woman has to stay in the house and the men go to work. And this kind of idea makes difficult that we have to good statistic, but always it's difficult that we can build politics and strategy to get better situation for women and children. I hope that that's all I can tell you. Thank you so much. And
A big hand for. Thank you so much, Aurora, and thanks for bringing up those social and economic barriers, and also mentioning the importance of sort of some of the perceived issues of trust and kind of the social norms at the bottom of all that. So then our last speaker, this but not last, please come and join me, Sabine Elena. She's the head of the Universal Birth Registration Project in Africa, the Bureau National of the Cameroon. So, and her presentation is going to be towards universal birth registration in Cameroon. Thank you. 10 minutes.
Bonjour à
Good morning. I am in charge to share my presentation. I am a woman and I work in the civil department in our government. I've been chosen to share with you what is happening in cases of birth as well as death and what are the interventions we developed in order to really move forward in the universal registry. Our plan is divided in 4 different parts, so for me to share with you properly our uniqueness as Cameroon, like culture, environment, as well as tradition, and then the different barrier that we came across during our studies, as well as the different strategy that we came up with and the way forward in order to improve our system. So I've decided to prepare for you a small video. This video will give you an insight of Cameroon characteristic as a country.
Terre de contraste où de paisibles montagnes font le dos rond face à des pics acérés, où des collines verdoyantes regardent des plaines arides, ou des forêts équatoriales jouxtent des savanes tropicales. À la diversité des paysages répond celle des pays et des peuples qui les habitent. Plus de 250 ethnies vivent au Cameroun, chacune fière de sa culture et de ses traditions, de ses dialectes et de ses croyances, de ses rois, ses reines et ses chefferies. Au nord, baigné par le poissonneux lac Tchad et le fleuve de la Benue, voici l'ère soudano-sahélienne, majoritairement musulmane, où la fantasia marque les grands événements. Mais les rites ancestraux perdurent, hérités des Sao, ces légendaires géants qui aplatirent les vallons en dansant et creusèrent des oueds en marchant. Au centre, au sud et à l'est du pays, l'ère Fan Beti-Boulou est le territoire des peuples de la forêt, dont les Pygmées. Ces plus anciens habitants du Cameroun ont préservé leur culture et respecté celle des Fans, venus sans doute du Soudan, avec leur cosmogonie, leur art du bois, de la pierre et du corps, et leurs nombreux génies qui accompagnent toujours les ancêtres. Le long du littoral camerounais vivent les peuples de l'eau. C'est dans cette terre que les premiers Occidentaux débarquèrent et que des centaines de milliers d'enfants et d'adultes réduits à l'esclavage embarquèrent. Mais si toutes et tous sont naturellement tournés vers le large, cette région possède une incroyable diversité culturelle. Chacun a développé une mystique particulière et parfois spectaculaire, comme la danse éléphant des Bakweri. Lors d'une cérémonie appelée le Ngondo, les Sawa célèbrent Nyambe, Dieu unique et trinitaire. Ils y honorent Dikoba, monde temporel de la terre et de l'eau, qui s'unit à Dikolo, monde spirituel du ciel. Enfin, dans les Grassfields, les chefferies très anciennes s'appuient sur la sagesse des morts. Les ancêtres ont façonné cette terre montagneuse, riche et volcanique. Ils l'ont cultivée, fertilisée, exploitée et transmettent à leurs descendants une histoire, des traditions et un art de vivre. Dans cette région, étonnant bocage africain, parmi d'autres peuples, vivent notamment les Bamoun, mais aussi les Bamileke. Issus de la famille des Tikars, eux-mêmes venus du Soudan, peut-être du Yémen, voient...
So you were able to see with me the complexity of our country, and the word that came so many times in this video, it is diversity. And Cameroon is 10 regions, 53 different departments, 350 registrar office, and we have 260 health district, more than 6,000 health center. So Cameroon, it is Africa. It's in small size in terms of religion. We have Christian, we have Christians. We have also the local population. As you have seen it, we have Moro, we have Pygmy, and many others. and that also brings some issue in terms of accessing. We have a huge forest, and then we are also sharing border with Chad, Congo, Gabon, Guinea Equatorial, and our population is more than 8 million inhabitants, with a proportion of at least 48% of women, and the rate of marriage, which is not been it has not been defined so far. So, as for in order to move in analysis on normal or social norms, we conducted some assessment that we did in Cameroon since the beginning of the reform in the year 2002, especially in terms of assessment, as well as the assessments of the year 2002 up to 2007. These two studies help us to bring some reforms, as well as the behavior of the year 2016 help us to redefine the vision of our strategy. It is based on these studies that we were able to come up with the strategic plan of the year 2018-2022. Then we conducted key assessments about the number of cases of newborn. In 2023, we conducted an assessment also about the registration cases of birth, and then we conducted 3 different studies that was much more focused on gender in a specific manner. We also look at the minority people, and this study was conducted in 2011. So these has been depicted by the video that was projected, and also we conducted a study on the registrar or either the martial state as well. So in 2002 we conducted some studies about the situation status in Cameroon. The two studies helped us to identify the number that we're going to share with you today. So as for the registry of cases of birth, we divided in 2 different levels, especially like we also focus on different barrier, environmental barrier, as well as how these how the structure is made, and also the behavior the behavior that people develop because of these barriers. In political issues, we realize that the main issue that we have in relation to the CRV, the CRV, most of the department of the government believe that these departments do not produce a lot of money, so therefore people are not very much interested, especially those who are working in the government, to really invest in the CRVs. So there is also a less interest for statistics. So today we are trying to put in place at least some structure that will help us to come up with vital statistic. And the state in Cameroon, it is characterized by a lot of stakeholders. So these stakeholders do have a specific role, especially when it comes to cases of birth and so on. It is important to put in place and to coordinate a different intervention, and to have at least a process that will push anyone to do what he's supposed to do, especially when it comes to birth as well as cases of death. So when it comes to environment, once we have identified all these barriers, we came up with a system for actors that are providing the services of about the material status. And if we do not understand the system, the service that we will provide to the population will never be quality services. So therefore, it reduces the trust from the public in terms of service delivery. We have also issues related to access to birth certificates as well as marriage certificates. So we have people who are living in forests, some are living in mountain area, and community living in this area do have difficulties in accessing service, CRVS. So especially when it comes, we have offices that are providing these services, but with a lot of difficulties, and they are having also issues producing statistic. So community most of the times reacted based on these environment and so on. Therefore, women do not really are not so committed to get involved in these activities. And sometimes they do not declare the number of children because of some cultural norm. So sometimes we have also the slowdown on these services towards the local people, because those services, first of all, are free. So therefore, the people working in those departments do not really have that kind of willingness to provide those services. So we also, for the cases of death registration, we have conducted some kind of analysis, and I will move to what is important. It is to know that the cases of death registration, it is a case that is not well conducted, and we don't have data, proper data. And then we also have different strategies that we came up. We know that to improve our activities, we need to coordinate the system. For us, it is very important. So we divided it in different levels. So we also took into account different actors in charge of assessing the system most of the time, and they are making sure that the system aligns with the international standard. So we came up with a plan to modernize the system, and we also conducted a charter for all the cases of birth, and then we also came up with a strategy in order to strengthen statistics and so on. So far, the outcome that we have, we came up with the law of the year 2024 that was voted. Well, it took time for us to have that act, but these act help us now to at least improve a lot of things in the use of the CRVS. We also have our famous perspective that will help us to better improve our system. So we came up with a strategic plan, and this strategic plan, we have the governance, and we came up with different groups that will conduct coordinations, and this will help us to better look at the issue of gender. And then we have also the creation of interoperability between cases of death as well as cases of birth, and we also look at the issue of financing and how to use the PPP in order to improve those services. The last one, this is our small dashboard. Since yesterday, we've been talking about statistics in order to show the implementation of gender, and also to learn about or to know where we should add resources and how data are collected. So we ended up developing another dashboard, and we are managing, and we've been using this dashboard, and very soon we are going to roll it out. Thank you.
Thank you, and thank you for the videos and excellent presentation. Really impressive how systematic you have been in analyzing all the barriers that you're facing, both at the birth and death, and then your future-looking plan. So let's open it up. You know, I've been pushing our presenters because we wanted to have enough time for questions and discussions and also contributions from you. So we have till 4:15. So keep up the energy, please, and let's open it up for any contributions you have, any experience that you have from using the sort of understanding social norms as barriers for registration. Something maybe that you haven't heard, do you want to bring up? Or if you have a question for our presenters, please raise your hand and introduce yourself, and please start. We have there and then over here. Introduce yourself.
Okay, good afternoon. Thank you for all the speakers. Really interesting presentation. My name is Widi. I'm from Indonesia. I have a question for Gloria regarding the social communication, social change communication. I think that's really, really interesting, and I want to know more about how do you engage like the traditional leader or religious leader. Is there a particular narrative that you use to convince them? Because in our experience, it's really hard to convince even the traditional or religious leader, and I think it's also should be part of the communication strategy as well. So if you could share the concrete example, what sort of like narrative or stories or angles that you use to convince them, that would be great. Thanks.
Thank you so much. I'll come to you, Gloria, in a second. Let me collect more questions. You had one over here, and then I come to you. Introduce yourself.
Ok, merci bien.
Thank you so much. My name is Ajemia Osius. I'm from the Ivory Coast. I would like to thank the panelists for their very brilliant presentations. So I would like to ask a question to my sister from Cameroon. From your presentation, you mentioned that the registration of cases of death, it's an issue in Cameroon. I would like to know, since you didn't have time to give us the strategic plan, what are the major actions that you came up with in order to really address this question? Because being at less than 10%, I think for me it is quite serious. So I would like to know, with these low rates, you also mentioned gender inequality. Is it women are less registered than men or not? If you could give us some clarification on that.
There, please.
Thank you. My name is Jessica Mvula from Malawi. My question goes to Cameroon. I don't know, maybe you said it, I just missed it. I just wanted to understand the intervention your organization or department or government has decided to take in dealing with the women that are refusing to declare their number of children. I think you mentioned something like that. I just had that same understanding as in what has been happening back home. Indeed, social norms can be a barrier to registration. Like back home, we had this experience whereby the women could not name a child that is not yet born. They felt it's something bad could happen to the baby because they haven't seen the baby yet. So it was very tough to register a child when the mother has given birth. But I would like to let this house know that we have experienced a drastic change in this social norm. We first made the health personnel where all the births always takes place to help addressing this issue by orienting the need of the mothers to prepare a name for their children before they get born. The orientations were like they can prepare maybe 2 names for a male or for a female because they don't know. And they had to make it known the importance of the mothers taking part in registering their children. As I'm speaking now, I can comfortably say we are almost maybe 90% at success on this issue. So I don't know what is happening, or maybe you said it, I didn't hear it, but I just wanted to hear what you're trying to do in Cameroon. Thank you.
Thank you. Thanks for that question. Any other question? Myra, please introduce yourself.
Sure, Maida Buvinic. Prompted by a number that I saw, I didn't see a number, but it said in Cameroon the percent that there were a lot of unwed mothers. And it's a question for all of you that we haven't discussed yet. Sort of it's what's the under-registration of births of children where the mother doesn't have a partner, either adolescent motherhoods or mothers without, that the partner has left them. In Latin America, that has been a huge problem for a long time. Children were stigmatized and oftentimes did not get registered at birth because of the lack of a father. Thank you.
Thanks, Myra. That's a very important question. Last question there, and we go back to the panel there.
Yes, thank you very much.
Please introduce yourself. We know you by now, but...
I am Willis Odek. I work for UNFPA, the Arab States Regional Office. My question is related to the social behavior change. I think we've gathered enough experience and intelligence from other programs in family planning, in HIV/AIDS response, that have demonstrated the importance of engaging men. I listened to the theoretical approaches that you outlined, and I think a social networks approach was lacking there. And one of the ways to engage with men is through the forum where they participate, could be work linked. We have a lot of young people involved in small business activities. So how do we engage men more effectively to address some of those challenges that were outlined? Thanks.
Thank you. Another excellent question. So coming back to our wonderful panel, Sabine, you have to start. You have 2 questions from the colleague from Côte d'Ivoire and Malawi. And then Gloria, you have 2 questions from Indonesia and the colleague from UNFPA. And then all of you, you have a question from Myra, which is very important on what is the state of unwed registration of children from unwed mothers from the country perspective that you have. So shall I start with you, Sabine? We have 2 questions. Do we have a hand mic that we could use? Thank you very much, Charity. Otherwise, anybody has a hand mic? Oh, there it is. Thank you so much. You have a sharp eye. Go ahead.
Merci pour votre intérêt pour le Cameroun. Donc, je vais commencer par la première question concernant l'amélioration de l'enregistrement des décès et comment est-ce qu'on l'a intégré dans le plan stratégique. Effectivement,
Actually, the cases of death in Cameroon is a concern. In our strategy, we decided to deal with it at different level. We have a strategy. We have a system. We came up with a strategy to integrate it in our activities. We also decided to work with the health sector in order to support or to push people to declare the cases of death, especially like in different health facilities. Changes are not easy. However, there is progress. So we are trying to bring the two. It means the cases of death as well as the cases of birth. So we conduct a lot of sensitization so that people to trying to teach people that cases of any cases of birth, it is also important. It has the same level as any cases of death, and then they have to be able to tell us who passed on and how did he pass on. That was our campaign, and then also we came up with a structure in order to come up with how we can digitalize the whole system, because we realized it was important in order to increase the number of declaration of cases of death or birth. So basically, these are some of the strategies that we came up with in order to increase the registration of cases of death. So what I can say, we have statistics of 2023, 2025. We were able at least to have some statistics, and we also realized some improvement. There was another question about the declaration of children or women who have given birth without any partner. So what are the norms? We need to understand the norms in Cameroon. Of course, it depends with the different area. So you have places whereby, or region whereby women are not involved in administrative procedure, and all these procedures are done by men. So for the registration of birth, which is a little bit higher, the idea, first of all, when a mother gives birth in any given hospital, the mother has to declare the birth of the child. So in relation to the community, we have what we call at the locality level or at the community level. Normally, the name of the child is not important. So these are things that we need to work on, and the state declared that the name of the child need to be declared, the sex as well as the date. This will help to improve the structure of registration. So once a child is declared, this child has an opportunity to have all the proper documentation and be taken care of in future. However, we have other norms that really push women to not declare their children. So for the single mother, we need to look at different area that we have, because in some areas in our country, it is okay. People can have a child without, without being married, and most of the time when they go to register the child, the mother goes with either the sister or the brothers in order to register the child, and they may end up having the name of either the sister or the brother. So we also have some other men that are married through customary law, and so the mother, normally you find, there's a lot of noise, there's noise. I can't hear, there's a lot of noise outside.
Description du mariage.
Thank you. Thanks, Avinda. You see the wealth of knowledge. So, yes, I highly recommend talking to her during break. We can hear a lot of birds outside, is it? Yeah. So over to you, Gloria. You have two questions and about 2 minutes. And then you have, if you want to answer Myro's question, and then we close. Thank you.
Thank you. In terms of the narrative on engaging traditional leaders, I think my take on this will be we need to speak their language. We need to understand what is important to them and their role at that community level, and being able to showcase that this is the modern way of doing things, you know. So I think that's, it's about fitting in their shoes and understanding their priorities and drawing on the linkages with registration, facilitating their position at community level. In terms of the question on engaging men, I think one of the examples I can give was in 2024, I think during the African Cup of Nations, we had a very effective birth registration campaign in which we engaged male footballers as champions, or what do I call them? As champions for birth registration, and that was really effective in terms of changing the narrative from it's women who are always talking about these topics to men who are renowned and who are brand ambassadors for their gender. So that is one way I think we can, one way that I think we can engage with men. In terms of the reflection by men, I think, yes, indeed, I do appreciate it. It's a challenge. I don't think we have the statistics, we don't have the data on that, but it's one of the reasons why we need vital statistics reports, especially when it comes to teenage mothers, to be able to have that data available. But I do appreciate the challenge. I think that's all that I can reflect on that one.
Thank you. Over to you, Aurora. 1 minute.
Thank you. I just want to say that in Guatemala, a single woman can register child. This law changed in 1985, and I think that this is the good thing that we have in Guatemala. We have great law that gives women's rights, but I think that implement the law is difficult because many people think that have right is not good, and I think that this is a challenge to change to our government and to the institution. Thank you.
Thank you. Thanks so much. I must say I'm really impressed. Many years ago when I started working on CRVS, I knew that social norms were an important topic, but we see so much advancement in understanding the barriers to the social norm, and both economic and social, political, environmental, all the aspects of that was mentioned. So join me to thank this group for a wonderful session, and we're going to have, I have to close, and you. I have to close, Esa. I've been told by, it's Charity that's pushing me to close, and I'm so sorry. So let me thank the panelists for a wonderful job, San, Gloria, Aurora, and Sabine, for the great presentations, and they're also, of course, available for further work. We also, San, have a beautiful website and the number of blogs that have been published on the website. So I really invite you to team with us and do a wonderful blog about the topic that you're talking about, which is really, really important. So again, join me to thank this great panel. And I'll give it back to Charity to announce where we should be next.
Thank you, Shade.
All right, thank you so much. That was very, very well done. Let's give a round of applause to our visitor, to our panelists and our moderator. Your claps are not saying that you had lunch. Thank you very much. All right, great. Allow me to make this very, very important announcement. So before we close or we transition to the next session, I believe even as you can hear from here, there's a bit of unrest. So we'll kindly request that because of the unrest reported on the roads this afternoon, the organizing team and the ministry are closely monitoring the situation to ensure everyone's safety. Please do not leave the venue until a clearance has been issued that is officially communicated by the ministry team. And this applies to everybody, whether you're sleeping here or you're sleeping outside. Kindly make sure that you are not leaving. We'll be able to update you as soon as we have the official guidance. But for now, please stay calm and stay indoors. indoors to mean inside Safari Park. Thank you very much. So we're going to transition into the breakout sessions, or rather the debrief of the breakout sessions. We had amazing breakout sessions for session 7 as well as session 8. And so to continue and transition to the next bit, we're going to take a few minutes even as we engage with one another as we wait for the rest of the team. And the question is, please take exactly just 1 minute. A lot of times we're always busy with kind regards, please find attached, I hope this email finds you well. So we never really take some time to reflect and look back at the milestone that we've done. So now that we're speaking about collaboration and partnerships, I want us to kindly just arise. We're just going to do this in a minute as we wait for the rest of the team to come. Let's kindly stand on our feet for a minute. So the conversation you're going to have with the person you're going to talk to, somebody whom you've not spoken to before, until now. Since we started, somebody you've not spoken to. The question will be, what is a story? Let's listen to the question. What's a story? You're already talking, the question is, what is a story or something that you have done in your organization that you'll still talk about in 10 years to come? Yes, that's the question. And then we'll be able to come back immediately after a minute or two once the rest of the team has joined us. Sorry? Something that you've done, a story or something of impact that you've done that you can talk about 10 years from now. So that's the question. Let's put our hands together for Priscilla. Thank you.
So I had the pleasure of speaking with Jessica Mvula from Malawi. She's the Registrar of Marriages. And I did most of the questioning and she did most of the answering. And I was just getting to understand a little bit more about what her work entails and how they are handling the different types of marriages and whether there is now recognition of traditional marriages specifically, and if there had been any pushback when that was being advanced. Because my question always has been, who decided that religious or civil marriages are better than traditional, when traditional marriages are so rich? You know, if anything, they are actually richer than the others. And so she indicated that at some point, the religious leaders thought that they are being stripped of their power of being the sole custodians of traditions in a different way. And but now it seems like things are working out. They are working on a law that will enable her office also to have sole custodian of registration of not just births and deaths, but also marriages. I hope I've represented our conversation well enough according to what we discussed. So thank you, Jessica, for coming by.
Amazing. Thank you. Let's appreciate Priscilla and her team member for that conversation. Thank you very much. So we're going to transition very quickly into the debriefs from the sessions that we had. And like I mentioned, we are going to get the session debriefs from the different chairs. And please allow me to just go ahead and introduce them on stage. So for session 7, we had different chairs for the different panels. So I'll call upon each one of them to just take exactly 10 minutes. We had the first room, development, assessment, and redesign of national strategic plans, emerging issues, and the next steps. Please welcome from Elgon A, Mr. William Muava, the Chief Demographic and Social Statistics Section, UNECA, to give us the session debrief for Section 7A. Let's put our hands together for Mr. William.
Okay, there was a change.
There was a change?
There was a change.
Gloria.
Yeah, I think either Gloria.
Miss Gloria?
Or Claudia.
Claudia. Oh, okay. My apologies for that. I didn't know about the change. Miss Claudia, you're in the room? All right.
Claudia.
Which moderator or panelist for session 7 is in the room for either rooms? Okay, please feel free. Put your hands together for Ms. Tanja, even as she takes us through the debrief for session 7. And Ms. Tanja was handling interministerial and interagency coordinations, lessons learned, emerging gaps, and potential solutions. Over to you, Ms. Tanja.
Thank you so much. And we had a very, very rich session with some fantastic inputs from 5 different speakers. The first speaker was from Indonesia, and she highlighted how they have taken the regional vision and regional goals of the Asia Pacific and kind of nationalized it. They have managed to set up a well-functioning coordination with 22 different ministries, which was extremely impressive. They also work a lot with different partners, but they're very clear in defining their needs to the partners. So it's very much a country-led approach. They also have developed very clear kind of outlines of which government agencies are responsible for what and how data is going to flow and so on, based on the extensive coordination efforts. And all of these great efforts have now meant that their registration rates have gone up significantly, and they are actually moving towards a register-based census. So that's quite impressive. She also mentioned a little bit about some innovative approaches that they had used to improve registration during COVID. So that was our first speaker. Our second speaker was from Vital Strategies, Subhastri, and she talked about the business process improvement work that they have done in many countries, which have basically been detailed mapping of registration procedures. And what she very much highlighted, which I really appreciated, was you can't just take a paper-based system and digitalize it and then hope everything will be much better. You have to really understand the processes and improve the processes at the same time. So she showed a lot of examples of countries that had used the business process mapping approach to improve their digitalization efforts, plus a lot of other things that had been improved as a result of that. And she also highlighted the importance of having a broad range of stakeholders involved in these mapping procedures, and also in defining the strategic goals and what should the new systems look like. Then we went on to a colleague from WHO who spoke about the Health Data Collaborative Partners Mapping Tool. And he highlighted how the fragmentation of partners in many countries, and how this tool basically they try to work to help map who are all these different stakeholders in countries. What I thought was really important there was they also use it to identify country needs and priorities, and how that aligns with partners' priorities, and how the different partners can contribute to the different elements. We also had the Civil Register from Kenya talking about the very clear vision for the CRVS system in Kenya, and how the national coordination mechanism and technical working groups under that mechanism have worked to support that vision. The overall goal is really to shift the responsibility of registration from families to the government and improving registration rates. The formalization of these groups have really worked in their advantage towards that goal. It's kind of formalized, and it also means that they have very clear priorities. But what I also really liked about his presentation was that it's really clear that it's a stepwise approach. They haven't gone from nothing to 100 in no time. They've really done it as a stepwise approach over time, and also realigned the processes over time, including broadening to additional stakeholders, and now also having more of a kind of user-focused approach. Our last presentation was from Zambia, and I really appreciated our colleague from Zambia being very honest about a lot of the problems and challenges, including in coordination. Things like, some MOUs that were in place that were not always reaching the goals they were meant to reach. And also what he highlighted, which I think is very accurate, is that you can't just put legislation in place and hope that that will solve all problems. Legislation and alone cannot improve systems. But what was really great in his presentation, what he very clearly identified the needs that they're working towards, and also the paths that they have towards improvements. And then he also highlighted some particular issues of inclusion for integration refugee registrations within civil registration. So we really had a very rich session with lots of different examples of coordination, both from your WHO more headquarter kind of focused. We had the country level, we had the partners and how they support, and I thought it was a really rich and versatile kind of illustration of how all these different elements come together. I think what was really clear in the discussions was that there's a lot of coordination happening at the global level, the regional level, the national level, but ultimately countries with clear visions, clear priorities, and who are able to communicate those needs to partners have a much more likely to have a successful path towards improvements. So yeah, a huge thanks to the amazing participants and also some great questions from the floor. And yeah, it was really an interesting session. So thanks to everyone for that one. Thank you.
Amazing. Let's appreciate Ms. Tanja for that amazing debrief. We move on to Ms. Gloria, who was handling Kumbaya Room, and the topic was digitalization, balancing efficiency and modernization with inclusion and accountability. Put your hands together for Ms. Gloria for that debrief.
Thank you. Our session explored how digital transformation for CRVS systems is reshaping governance, inclusion, and accountability across different contexts. And we heard from the Gambia, Somalia, Kosovo, and from a global perspective provided by one of our counterparts from the IUSSP. So the conversation generally unfolded from innovation to resilience and reflection on how countries are embracing technology to modernize CRVS systems. From the Gambia, what we had is the development of a very interesting interoperability model that links CRVS ID to numerous other government platforms. And we were able to see how the system is being woven across linking justice, health, social registry, social security, and in the future, the revenue authority, which was quite interesting. And we also heard of the progress they have made in terms of enrolling their population into the CRVS platform so that it really serves as the true foundational source of identity data from the government. So from Gambia's experience, really the key story was about demonstrating integration and interoperability and how this can be achieved in a resource-constrained setting. And then we went to Somalia, and Somalia's example was one of resilience in a fragile context. We heard of their story for quite a number of years. They've been having less than 10% of births registered, and over the past few years, they've really embarked on a journey to build very good policy framework for CRVS, starting from a comprehensive assessment to a strategic plan to a CRVS bill, which is currently in the pipeline. And they also spoke to the fact that they have embarked on an initiative to implement an open source CRVS platform with their data hosted in the cloud. And that is mainly driven by the fact that they want to have a resilient system that would, which is needed for their context. So we've heard that they've rolled out Open CRVS in 21 districts, and there's progress to develop modules like marriage, divorce, guardianship, household registration in the future, basically building on that platform and making it more robust and ensuring that it's rolled out in other parts of the country. So Somalia is really an example of, building from a very difficult context, but putting resilience at the fore. And we were inspired by their story. And then we heard from Kosovo, and it's a country where registration of vital events is really advanced. And what we had, Kosovo demonstrated how modernization can enhance data quality, timeliness, and coverage. We also heard that their digitalization journey is closely linked to the country's ambition to establish a statistical population register. And their experience underlined the importance of harmonizing data on international standards and investing in digital skills, cybersecurity, and ensuring that technology serves all citizens equally. Then lastly, we heard from the IUSSP fellow talking to digital public infrastructure safeguards. And she reminded the audience that CRVS does not stand alone. It is building on a bigger block of work, which is the DPI ecosystem. And she talked us through the UN DPI Safeguards Initiative, which promotes universal principles that protect individuals and communities from exclusion and discrimination. So yeah, the conversation there to do with the DPI also had a touch on how do we position CRVS or how do we position the CRVS community in that context so that we leverage on the current attention that is being given on the digital public infrastructure and demonstrate the value of the work that is being done and potentially also leverage resources that will be made available. So the last part of the discussion talked a little to social norms and legal barriers. We reflected on how discriminatory laws and social norms continue to shape who gets registered and who remains invisible, especially in low literacy or low digital environments. We also talked about the need for adaptation of platforms to make sure that they are context aligned. For instance, use of mobile phones, USSD, and apps that would make the last mile of population covered. And yeah, we also talked about data standards and accuracy. The importance of collecting data for registration data on place of occurrence and the place of usual residence. So yeah, to conclude, it was a very vibrant group, and the Gambia example of integration, Somali demonstrating resilience, and Kosovo showing how to build inclusivity to ensure that we have everyone included. Thank you.
Amazing. Thank you so much, Ms. Gloria. That was balancing efficiency and modernization with inclusion and accountability. So that was technology when it meets humanity and all. So let's put our hands together for Ms. Gloria for that amazing session. All right, so we have the third room. Is Ms. Claudia in the room with us now? Ah, perfect. She's here with us. And so she's going to tell us the debrief on session 7, development, assessment, and redesign of national strategic plans, emerging issues, and the next steps. Over to you, Ms. Claudia.
Thank you so much, and apologies for my tardy arrival at this session. And I do hope that I can do the discussion, the robust and interesting discussion that we had justice. And I really do think it builds on the point that Tanya made from her session about the importance of having a clear plan within the country communicated to the partners so that the needs are clear. And the strategic plan is really the beating heart of that. So I was very honored to have representatives from Ghana, Sierra Leone, and Namibia. There were some strong themes here. So the assessments of their previous strategic plans, these are very deliberate and they take time, between 2 to 3 months. So each of these countries has taken considerable amount of time and resource to very deliberately reflect on previous strategic plans, think about how they can evolve to address new needs, and to think about some of the challenges that the previous strategic plans had. I'm not going to go through specific presentation by presentation, but I think it was clear that there were some challenges in terms of coordination, but also challenges in terms of resources and challenges in terms of changes within the leadership and the buy-in for the strategic plans. So how do you ensure that these long-term strategic plans remain at the forefront of the country's development objectives, where there are leadership changes, challenges of new governments, complex systems, and very, very, very many stakeholders. And each of the representatives within our session had some great tips and advice and experience to share in this. In particular, I was struck by how each of them had taken engaging around the new strategic plan and the review of the old strategic plan really to heart, engaging both at different geographic levels. So there were engagements happening on the strategic plan at the national level, but also the subnational level, but also very deliberately across the stakeholders of the CRVS system. So we often think of the stakeholders of the CRVS system, the Civil Registration Authority, the Ministry of Health, the Statistics Authority, but it's clear that there are many, many more. Over 30, some of these countries had identified and had been very deliberate in each aspect of that system by providing technical working groups and then mixing these stakeholders up. So some of those stakeholders may only be interested in the death registration side, some in the marriage and divorces side, some in the birth registration side. But to look holistically at a system, you need all of your stakeholders on the same page to understand why this comprehensive strategic plan is needed. And there were some great tips there in terms of being able to split out into technical working groups for each component part of the system, but ensure that actually you're mixing those stakeholders. So, for example, the technical working group on birth would have representatives whose specialist area was marriage within that, so that they were always thinking and creating opportunities to think about the interlinkage between the holistic system. And I thought that was a great tip. We often talk about the difficulty of bringing people together onto the same page, and I think it's particularly acute within the CRVS system. And remembering that it's not just 3 ministries, it's probably at least 30, and then you have the need to engage with your citizens and with the rest of your country to ensure that you've got the buy-in at that level as well. There was also a lot of work in terms of actually it's very, very important to understand that your strategic plan needs to be resourced. Yeah. And one of the challenges that was learned from one of the countries was that a strategic plan wasn't approved because the resource wasn't there for us. So this needs to be thought about up front as well, and resourcing those strategic plans is vital, but then also monitoring the financial projections of that strategic plan. So a really strong focus on monitoring the performance of where you're trying to go as part of that. I'm just flicking through my notes, so bear with me. So some key themes here. The strategic plan is really catalytic for reform, both legal, we're thinking about digital, we're thinking about inclusion. It covers all of these things, and it really is that foundation that is your ask from development partners, but also domestically, to ensure that you're getting the resource that you need. And importantly, the strategic planning is never done. It should be a living document, an evolving document. As your needs evolve, your strategic plan should evolve. And I think I'll leave it there, a living document. So much to learn from these countries, and it was a great discussion. Thank you to everyone who joined in, and especially thank you to the representatives from Namibia, Sierra Leone, and Ghana for sharing their experience.
Amazing. Thank you so much, Ms. Claudia. Let's give her a round of applause. So that was session 7, highlighting coordination in action, technology, the heart and humanity, and finally we finished with the strategy. And something that I noticed is a reminder, it was a reminder that strategy without action is just a very expensive wish list. And that's why we are here to work together to make these things happen. So we're going to transition very briefly into session 8, very quickly. We'll start with debriefs from Eldon D, where the focus was on engaging social and behavioral norms associated with under-registration of vital events. And we have Ms. Shaida, who is going to guide us through that, who was the chair for the panel. So put your hands together for Ms. Shaida.
Thank you. Thank you so much. It just finished a few minutes ago, so bear with me to get some notes together. I think the topic, the social and behavioral factors associated with under-registration of vital events, are tremendously important and cross-cutting across all the discussions that we've had in the past 2 days. And so we heard a lot from the representatives, great presentations from Guatemala, from Cameroon, from UNICEF, and also from representative talking about the Nepal, India, and Bangladesh, particularly on how to make the registration much more inclusive in terms of capturing intersex and gender identities. So it was very interesting. We learned a lot on how countries are doing in kind of the frameworks and what they're doing in understanding the social norms and the barriers, both socially and economic barriers. But also, both for the birth registration and death registration, the barriers, but also what they're doing to address it. And it was really impressive how systematic, for example, we heard from Cameroon, how systematic they are of going about it and developing that understanding. And it shows that we really need to invest in that and understand it more and also help countries to do that sort of analysis. We learned that the variety of the barriers and the social norms that we're talking about, from the ignorance that some communities may have, perceived irrelevance, conflicting some of the customs, and sort of the stigmas which are associated, the prejudice and the stigmas associated, for example, with women who are giving birth without being wed. And of course, the gender norms and sort of the trust also, the issues of trust for the government and trust in the system has been identified as one of the barriers for social norm. So it was a very interesting discussions, and we will have more elaborate notes in the outcome document that will come out. And let me also take this opportunity to ask Gloria and Claudia to pass on the rapporteur notes to us, because we're compiling all those notes, and some of us who were taking notes, we couldn't be in all the sessions. But thank you so much, and really enjoyed that session.
Amazing, thank you so much. Let's put our hands together for Ms. Shaida. That was on engaging social and behavioral norms associated with under-registration of vital events. Next, we have Ms. Jubero, who was handling strengthening alignment of CRVS systems for monitoring and measurement of femicides, enforced disappearances, and missing persons. Over to you, Ms. Majubero, for that session.
So a small disclaimer, I'm not Majubero, but I did chair the session since Ma was stuck on the other side of town due to the security and transportation situation in Nairobi today. So Ramesh Silva from UNFPA. Our session was really focused on trying to understand some of the challenges and opportunities to connect up different types of systems, particularly medico-legal death investigation systems with death registration and other systems, to improve death registration and mortality statistics, particularly when it comes to different types of violent deaths, and violent deaths which have a strong gendered context to them. We had 4 excellent presentations, and I think it would probably be easiest to just walk through them in sequence. The first one was by our colleagues from UN Women, who really presented an exciting and very important new statistical framework for femicide data and measurement, which was adopted just last year by the United Nations Statistical Commission as a new official statistical standard. And so we should take pause here. This is the first time internationally that femicide data and femicide measurement is being recognized as an important component of official statistics and therefore public information to support accountability around these kinds of these phenomenon. So our colleagues from UN Women and UNODC have really done very important work in getting that into the official statistical lens and standards. The new framework does a very important job of providing statistical definitions to what is meant by femicide. And I really do encourage colleagues to look at some of the presentation slides and particularly look at the new framework, which is available online. It unpacks 3 main sort of types of deaths which constitute femicide. the first two being women and girls killed by intimate partners, and women and girls killed by family members, and then the third being women and girls killed by other known or unknown perpetrators, according to a bunch of different criteria, which are quite complicated. Things like, hate crimes, or whether there was sexual violence preceding the death, and other things. The point here is to say that one of the challenges here with femicide measurement is to detect an intent to kill, based on gender. Somewhat humbling, our colleagues from UN Women reported across the African continent, of the 54 AU member states, currently 19 states provide homicide data disaggregated by sex to the United Nations. Now, of course, homicide data disaggregated by sex is not the same thing as femicide data, but it gives us a sense of the long path forward to make progress here. The other big news from our first presentation was really important work in Djibouti, Lesotho, Ethiopia, and Kenya in testing the new femicide framework. This testing by colleagues from UN Women and UNODC has done a really important job in identifying fragmentation in femicide data systems, heavy reliance on paper-based systems, but the testing itself has helped raise awareness about some possibilities for improvement in those countries, and secondly, has helped to spark new conversations about how to adapt the framework to different local contexts. The second presentation was by the Chief Medical Examiner from Sindh province in Pakistan, and Dr. Sumaya Tariq walked us through a number of things, but first and foremost, she really gave a harrowing human face to the phenomenon of femicide in Pakistan, sharing with us a number of very recent cases and what they look like and how they present through the medico-legal death investigation procedures and processes in Pakistan. Similar to what was described by UN Women, she described a very worrying situation, a situation where there's a lot of process, there's a lot of procedure, there's a lot of data, but that data is fragmented across many systems like the hospital system, the cemetery system, the police record system, medico-legal and examination records, and then the civil registration and ambulance system itself. And so the big challenge that she described is to connect these systems up. And she highlighted that just looking at the own data that she is a guardian of in terms of medico-legal death investigation, she showed that there's a lot of detail and a lot of rich data about critical characteristics of homicide which can be used to identify gender-related killings. Things like the relationship to the perpetrator, previous records of harassment, and sexual violence, and other key things. The key take-home message here is there's a lot of data, and there's a lot of potential with that data, but it's quite fragmented, it's not easy to access, and she left us with a number of practical suggestions and recommendations in terms of digitalization, in terms of better coordination, and just joining up these different sources and systems. The third presentation was from Max Merck from the UNFPA country office in Mexico, and Max gave us a really powerful overview of the phenomenon of mass disappearances and missing persons in Mexico. He highlighted the scale of the problem. We're talking about approximately 130,000 currently missing people in Mexico. At least 70 of those 1,000 bodies remain unidentified by the forensic services. This is translating into about 59 homicide victims per day. He also gave us quite a bit of hope. He highlighted that the presidency of Mexico has really weighed in on this emergency situation and a need to address disappearances as a national priority. The president herself has called for the creation of a national human identification platform. What Max helped us understand is the possibilities of a lot of the forensic type data, which is being collected, how that data could be better connected to civil registration and the ID management system in Mexico. He highlighted that the forensic data, there's actually quite a bit of transparency. Many states inside of Mexico publicly report in open data portals about the different disappearances and missing persons. And so this is a really important opportunity to mine that data and connect it up with the CRVS and ID system. He particularly gave us a better understanding of the gendered nature of this phenomenon. Victims are almost exclusively male, of the ages of between 18 and 45. He highlighted the legal and emotional burden that falls on mothers, wives, and sisters who spend pretty much their remaining lifetime searching for the bodies and searching for answers and accountability for their loved ones. And he described the legal paralysis which goes along with this in terms of just getting really basic things like access to compensation and other entitlements because the state doesn't recognize that these people are dead. And so therefore, the mothers, the wives and sisters are unable to access basic things to try to move on as best as possible. Our fourth speaker was Olga Jose from Howard University, who continued on this theme of strengthening medico-legal death investigation systems to advance inclusive mortality statistics. She gave a really interesting presentation which drew from examples from Sri Lanka and the United States, highlighting a number of different issues in terms of how the legal framework can advance or sometimes impede the transparency and inclusiveness of medico-legal death investigations. She also highlighted a number of social norms issues, particularly in small rural areas, where different members of the police and sometimes the medical profession are really impeded by providing detailed documentation on what exactly happened, even though they are privy to a lot of these details. And then that essentially results in a censoring in these data systems whereby that information doesn't translate, isn't recorded into the MLDI systems and therefore provides invisibility and a lack of accountability in terms of what has happened. But in short, I think what it's fair to say is that this session really outlined some hope and opportunity for death registration, particularly when the death involves violence, for those deaths to be better connected up with the civil registration system so that every death counts. And the state responsibility to register those deaths is met. So much more work to go. Thank you.
Okay, awesome. Let's give it up for Dr. Romesh. Thank you so much for that nice debrief. So it's a reminder that behind every data point is a life, a family, a story, and that accurate record is actually a form of justice. So we're going to the next and our last debrief for the day from the session 8. And this specific session was about vital statistics as a tool for advancing gender equity and women's empowerment. These were the people in Kumbaya room. So I'll invite Ms. Claudia to go ahead and give us the debrief. Over to you, Ms. Claudia. Please take.
I'm going to hand over to my colleague William from ECA, who chaired this.
Been promoted.
No, that's fine. I guess we all know, the process from civil registration, vital statistics. So one of the things which the group looked at was, why do we produce vital statistics reports? And we are all agreed that vital statistics reports are fundamental for the, to show the demographic and epidemiologic measures that are needed in national planning. It's quite an important data source where you can actually, measure demographic indicators, epidemiologic indicators, and also we should recognize that CRVS contributes to about 67 indicators of the SDGs. Birth and death registration information from civil registration is also critical for government activities. For example, construction of population registers, administrative registers in commercial enterprises like life insurance. Those who have done a course in actuarial analysis, I think you realize how important information about births and deaths is actually critical in calculating our life insurance and things like that. And also for marketing products. In the health sector, vital statistics are actually very important for the core. They reflect the burden of the disease and so forth. So based on these, observations, we had just two presentations, one from Georgia and the other one from Indonesia. So obviously I will take like half the time my colleagues took, and also I think people were just lazy to walk down to Kumbaya, so we were very few. So from Georgia, what we learned from their presentation is gender disaggregation on vital statistics reports is mandatory. And then they gave examples of the basic one being the sex ratio at birth, maternal mortality, and life expectancy. They also use civil registration data for monitoring their universal health program. Then CRVS is also used, for financial social assistance programs. They have a very strong social assistance program, which actually is very dependent on the CRVS, and also targeting programs for improving the demographic situation in the country. For example, what it means is actually monitoring population dynamics on a continuous basis. That can be birth rates, death rates, immigration. Then he gave us about 4 or 5 use cases. The first one being where they use, CRVS data or vital statistics reports. The first one being their maternal health policy, which is anchored on CRVS. Then the second one is assessing the sex ratio imbalance in Georgia. And it's interesting to note that their sex ratio is actually 1 to 1.11, quite an imbalance. Then it's also used for measuring child marriage prevention. I think it's quite obvious because ages of those to marry or to be married are picked in the CRVS database, and if either the groom or the bride are underage, then that's flagged. Then also aging of the population and gender equity policies. Like any other, they face challenges, especially on cause of death. 22% of the cases of causes of death remain undefined, but it's not as worse as in our continent. But then they have also other challenges. And one of the recommendations there is to strengthen the foundation through ICD 11 and expanding gender analysis and improving data analysis. Then the other presentation was from Indonesia. And I should highlight here, one of the things which is done in CR and never done in VS is this part, which there are actually business processes for vital statistics report production, but most countries rarely do it. And I was impressed that Indonesia does the use of business process mapping for compiling and for the process of compiling vital statistics report. Let me just take in a caveat that we actually have a document which guides countries in terms of doing this business process analysis for the production of vital statistics. And I know, like on the continent where we are, it has rarely been used. So this is a cry for, people should actually use it like Indonesia. They do measurement of completeness, a very big exercise. Actually, they have a publication which they showed us. And they also, like Georgia, do gender disaggregated analysis. And an additional piece of work, which possibly we are also doing, which is being done in the Asia and Pacific region, we have also started doing it on the African continent, is the inequality assessments. There are quite a number of methods being employed, but in Indonesia, they actually did an analysis and produced, a report, which I guess they can share with those who are interested. Then gender gaps in birth registration was also highlighted as part of, the analysis, what it is bringing out. So effectively, our main recommendation is that countries should produce vital statistics reports because of their policy value and also help to identify problems with the civil registration system. So the second part of that statement, we are just emphasizing that the vital statistics reports can feed back into the civil registration system. For example, if there's a district where there has not been any birth, that's an anomaly. That can be flagged in the civil registration report. Or the sex ratio is so imbalanced, you can actually see which children of which sex are being left behind and so forth. So that's the part of vital statistics reports which we want to start emphasizing. How does that vital statistics help to strengthen where the data is coming from, which is civil registration? Let me end there. Thank you.
Thank you so much, Mr. William. Let's appreciate him and all the that last section. If today we were hiking, we'd have said we saw, we went, we saw, and we conquered. So thank you so much for participating. Give yourself a round of applause for sitting through all the sessions. So we're going to have a debrief for the key pointers and highlights from today's session during tomorrow morning session. So please be sure to come back. When you come back, we'll be able to have those highlights and the rapid review of day 2 by Dr. Priscilla Idele. So we want, because we care very much about your safety, we have a special announcement from the hotel to give us an update about the security or a brief, and then I will conclude with a few remarks. So let's put our hands together for Sam from the Safari Park Hotel with security details.
Everyone, my name is Samson. I wasn't here when she introduced me, so I'm not sure whether she said I'm the chief security, but I work for the hotel, sales and marketing. I'm here just to brief you on an incident that took place just right outside our gate. There was someone who had snatched a mobile phone, and he ran towards the hotel, and people were trying to lynch him. So what our security did, they rescued him from the mob, and we have called the police to come and take the gentleman away. So I know most of you, because of what is happening around here, because of the memorial that is taking place, some people are a bit anxious. So this is just to reassure you that the hotel is quite safe. There's nothing to be alarmed. We usually work closely with our neighbors, Kasarani Police Station, the diplomatic police. We have quite a number of international guests with us here. And if you have noticed, this is not the main highway. Yours is a feeder road, so it's kind of less busy. The main super highway is where most of the activities are happening, because our main stadia, Kasarani, is right opposite, and that's where the viewing of the body is taking place. So because of that, there's quite a number of activities that are happening on the main super highway. So I've been advised by the chief security that people should avoid using the super highway, but if you need really to step out, there is an alternative route which is right behind, that leads to our northern bypass, that can lead you to either Gigiri, United Nations, and the other environs. However, I'm aware that we are planning for dinner for quite a number of you. Violet had booked some dinner, nyama choma. So the general situation is that once the viewing is over, the road, everything will return back to normal, and it will become for you to drive home safely. So for those people having dinner here at the African restaurant, because the dinner begins from 7, the show begins at 9. So ideally you should be through with your dinner about 10 o'clock thereabout, and we anticipate by that time everything will be quiet. So I felt it's good just to clarify what was happening here. It has nothing to do with the mourners who are going to the Kasarani. It is somebody who took an opportunity to snatch a mobile phone, and our security were there to prevent the mob from lynching the gentleman. So I felt it's good, because I've explained to a few people, but it's good to explain to everyone, just to reassure that the hotel is secure and is safe. So thank you very much, and have a lovely evening.
Thank you so much, Mr. Samson, for that amazing details. At least now we know what has happened. So ladies and gentlemen, I know we have been seated for a while, and we had very many expectations, and we've had good conversations. So we've come to the end of our day 2. I'm going to give us a few announcements, and then we will wind up the day. So we have our dinner happening at the here at Safari Park Hotel. The cost for the dinner is 4,800 Kenyan shillings. You can be able to pay these either via M-Pesa, cash, or via your card. So once you go to the registration desk, you can be able to swipe as well. So we invite all of us to kindly come in. We are going to dine, to enjoy, and it's going to be, the Gen Zs say good vibes. So it's going to be a good vibes dinner. Please be sure that you come and you join us. But otherwise, it's been such a pleasure being your host today as well. I look forward to seeing you tomorrow, God willing. We are going to be reunited back here. We'll start the program at exactly 8:30 a.m. for session 9, which will start us off with parallel sessions on CRVS and gender use cases. So we'll be able to give you the details, the breakout room sessions, the chairs, and the rest of the details immediately after we are settled tomorrow in the morning. If you have any questions, the Billion Events team is ready at the registration desk with all inquiries that you have, and they'll be able to guide us. Last thing, I would kindly request all of us to stand even as we end the day. Let's stand and do a very quick breathing, and then we go. All right, so let's kindly stand. Don't carry anything on your hands yet. All right, so we're going to do 3 deep breaths. This is not a deep breath of, finally I'm no longer seeing her face, but I'm going to miss her. I'll see her again tomorrow, okay? All right, so breathe in. Hold. Breathe out. One more time, breathe in. Take in all the good energy. Hold. Breathe out. And last one, a big collective inhale. Let's go. Breathe in. Hold. Breathe out. Awesome. Thank you so much. Have a lovely evening. I'll see you tomorrow in the morning. God bless you.